Propel's impacted my practice, one, because I think patients are happier when they can go through the process quicker. Orthodontics is not a fun process to go through, and as we know as orthodontists, we do everything we can to help negate that. We offer wooden tokens, we give prizes, we do contests, we do everything that we can think of to make a difficult process easier. And by speeding up the treatment, it's a very nice service that we can provide to the patients.
Being able to take an 18-month treatment plan down to 9 months, 10 months is wonderful. And I'm capturing this whole other market, those women who are about to get married. And they say, hey doc, I'm getting married in 5 months, what can you do to me? I used to say, where have you been for the past 18 months? I can now say, hey, no problem, let me take your digital scan now, I'll have your aligners in 2 weeks, I'll propel you, and I'll get you through 20 stages of treatment in 20 weeks.
I have one gentleman that he's getting married in a few weeks, and he and his fiancée are so excited to be done with orthodontic treatment. And it's been a huge part of their discussion in preparation for their wedding that this technology has allowed them to get braces off so that they can have their wedding with no braces on their teeth.
All of us can remember the case where you closed one side on the extraction space and not the other. And you've labored to try to get it. You've even increased your interval of seeing the patient. And then when I heard about Propel, I thought instantly of several patients in my practice that had been lingering in treatment, and I presented the treatment to them and they accepted it, and it was actually the difference for us to actually close the deal and be done.
My adult treatment time, it is literally cut it in half, 50% reduction. So for me that means for my Invisalign patients, Invisalign makes up about 60% of my new starts. And for me, I can tell a patient with confidence that I'll get them to the refinement process in half the time. And then for me as a doctor, aside from saving visits, chair time, when I get to the refinement, that also means that there's less to do in the refinement process because the teeth track so much better during the first stage of treatment.
I've recommended Propel to a bunch of doctors. In fact, I was lecturing recently in Japan and I was asked this question in front of the group, and I said, well, I think there's going to be one major player that most people are going to want to incorporate in their practice, and it's going to be the Propel device.
I have some great friends who are orthodontists, friends that I went to my residency with. I have friends that we call and we talk about how our practices are going, what we've added, what we're changing. Saying, hey, you need to look at Propel and learn about accelerating orthodontics and be on the leading edge of this, because if you're not on the leading edge, someone else will be. And this is something that's working in my practice, something my patients love, something I'm now getting referrals for, and I tell them you've got to try Propel.
At Temple University, I'm an attending in our postgraduate orthodontic clinic, and we are currently treating a medical student who was a 4 bicuspid extraction case, severe crowding. And we talked to her, and she definitely understood bone physiology and what what Propel could do for her. We basically used Propel in all 4 quadrants, and she's now in her 6th month of treatment. And I have to say, every faculty member there is surprised at how effectively, efficiently her teeth have moved.
I use Propel as a rescue club when I have my traditional mechanics aren't working the way I want it to, or it's not working fast enough. When a patient looks up to me and says, hey doc, is there any way we could make this move along faster? Propel is the first thing that we talk about to get them what they're looking for.
For every new patient that I see, every new patient, I mention the Propel technology. And I never push it. I simply say, here's the latest and greatest we have in technology, and here's how well it works. Here's some examples before and after in the treatment time, and it really sells itself.
But patients overwhelmingly get up from the chair and say, oh, that was so simple. I was worried for nothing. And one day of discomfort with one phone call to follow up, check on them, showing that we are interested in their well-being and how they're doing. And really, I don't have apprehension for them to do it again.
If I were to tell a colleague who's not currently using Propel, I would say use it. Your patients will be happier, you will be happier, because you're going to get more efficient, effective tooth movement. And that's what we want for our patients. Not only do we want to go through treatment effectively, but we want it efficient. And time is an important factor for so many of our adult patients these days.
Propel is making a big impact on my practice, and we've had patients come from out of state specifically to my practice. I'm in Washington, D.C. We've had patients come as far as North Carolina specifically for Propel.